This is Bill Schultz, historical writer at the Medical College of Wisconsin, and I have with me today Josh Bonis, who received his PhD at the Medical College in 2009 and his medical degree in 2013. Josh, thanks for joining me today.
Good morning, thank you.
First question, tell me about your background. Where are you from?
I'm originally from Milwaukee. I was born here, lived here until I was a child, moved up to Plymouth, Wisconsin for about 10 years. And then after my freshman year in high school, I moved up to Eau Claire, Wisconsin, and finished out my high school education and did my undergrad degree down there, graduated from UW Eau Claire with my undergrad in 2003, and then moved back down to Milwaukee, so kind of circled the state.
Okay, no, that is, Eau Claire's a great area, and UW Eau Claire's a great school.
And you're a fellow alumnus of Eau Claire too, aren't you?
No, UW Madison, but we talked about swimming.
Yeah.
Because I've got some friends that swam at UW Eau Claire, but way before, probably before you were born.
Yeah.
So, you have an interesting association with the Medical College of Wisconsin. Your grandfather, Irv Kuglich, is a member of the class of 1952 and a leader. I always worked with Irv on the reunions. Your uncle John is a member of the class of 69. And you first came here as a graduate student, got your PhD, and then went to medical school. Can you tell me about your decision to, first of all, to come here to go to graduate school?
Well, I had gotten out of undergrad and was kind of figuring out what to do. I had applied at a few medical colleges, not a lot, but Dr. Forster had come up to UW Eau Claire and given a presentation, and then myself and another friend from UW Eau Claire came down to visit the lab after his presentation and just really enjoyed it and decided to just spend a year, come down here and do some research, and just wound up really liking it. And so I think that's how I came to the lab.
That's good.
The rest is history.
So you had Dr. Forster from our graduate school visit Eau Claire, and so you came here, and I know you finished your PhD in physiology. Aren't the grad students usually in somebody's lab while they're here? And whose were you in?
I was in Dr. Forster's lab working as a technician. I was working as a technician for Matt Hodges, who's now faculty here. He was a graduate student at that time. It was interesting because then he came back as faculty, and just as I was finishing graduate school.
You know, before we talk about, the leap to medical school, in your PhD years, are any faculty that you, when you think back, fond or not fond memories of?
I always remember fondly my time in the lab. We did large animal research, so it was a very tight-knit family type environment, very, very close. And I always was fond of Bert's mentorship and friendship.
And the
Bert Forster,
Forster.
He's still a great colleague to this day, and I like to go back and visit when I have the chance. There's a lot of great faculty here. They run great labs and great teachers and great people. But I do remember Dr. Green, just an excellent teacher. He just always has that little bit of insight that you're looking for. It's a great resource and a great person to count in your life.
No, that's great to hear, and that's one of the fun things about doing these interviews. We hear some names over and over, and we hear new names, and that's great. Now, during your time in the graduate school, you obviously you got very involved because you eventually were the president. Were you the president 1 year or 2 years of the Graduate Student Association?
I was in the Graduate Student Association for 3 years. I served as physiology representative, then president, and then past president.
Okay.
So 3 years altogether. I gravitate towards bigger picture problems and issues, and I think that's one of the platforms to which we can deal with that and try and improve and collaborate and contribute.
Well, I know that's where I first met you, and you were great to work with, and that Graduate Student Association certainly has to make the grad students feel even more welcome here at the Medical College of Wisconsin.
Yeah, I really enjoyed it. It was a good way to meet people from other departments, and it was a great way to interface with the medical students. And that was one of my goals, was to try and bring the graduate school and the medical school together a little more. because you don't always get as much exposure as you'd like.
No, you don't. And that sort of leads into that next question is, I don't know what your career plan was, but you're here for graduate school, and then you finish PhD, Dr. Bonis. Now you're going back to medical school right away. Was that the plan all along, or was it while being here for grad school that you got the bug to carry on to medical school?
Well, I had applied to some medical schools after undergrad and didn't get in, and your plan evolves through life. The only thing constant is change.
Right.
So I had to sort of revisit the issue of whether or not I wanted to try it again. Is that something that I wanted? Obviously decided to do so, and very glad that I did. It's just a different decision for everybody what they're going to do with their PhD or their advanced degree. What more is an MD going to bring you, and why do you want that? What are you going to do with it? So to this day, my career plan is still evolving. What I want to do with the achievements that I've had, where I want my life to go. So
well, if nothing else, you need to have a big wall to put all your diplomas.
No, actually, I don't even have them all framed yet.
Well, when you get out of your residency, you can do that. But we've had some extremely distinguished alumni that have done the PhD. Someone who Gary Colasari,
Mm-hmm.
PhD and MD, and former chair of anesthesiology, John Campine, many years ago, had the PhD MD. So it's a path to. Is it a path to greatness? Maybe.
Katie Krause, who was a year ahead of me, did the same thing from the same lab. So we were very close. And Julie Freed, who was from Dr. Green's lab, did the same path. So I think physiology has a nice history of, advancing graduates on to medical school and in addition to other endeavors.
My sense is that physiology for decades has been a star among our departments. I interviewed Dan McDermott, class of '69 with a PhD, and he was our first graduate school alumnus of the year. And even back in the 60s with Dr. Jim Smith, the PhD program in physiology was really something, and I know it's highly ranked nationally right now. The question I have, with your grandpa being such a distinguished alumnus and physician, and somebody who you say Irv is what?
91.
91. And didn't he just retire literally a few, or is he still working?
No, he's not working anymore.
But he was working till his late 80s.
88 or 89. Right. Yep. He got tired of waking up early in the morning, he said. But that's, admirable to anyone to be working that late in life, let alone, to accomplish what he had done and have such a distinguished career, as you say.
Well, as you know, today is the symposium for senior physicians, and a number of times your grandpa said, I can only come for half the day because I'm working. So, the other thing, you're, from a standpoint, you come from a family that has physicians. Do I recall, was your mom a nurse?
My mom went back to school and got her PhD in nursing later in life. So she does nursing research. Two of my aunts from that same side of the family are dentists, and my uncle's a urologist, and then my grandpa an anesthesiologist. So I've had some role models in my life. Another big role model would be Carol Miles, who's also a graduate of the college.
Yes.
She was a big factor in my life. So between her and my grandpa, really, two big physician role models.
Yeah, and something, I'm really happy you mentioned Carol, because Carol was a real superstar alumnus, died way too young. But Carol was a member of the class of '83 who had been a nurse, as you know, and went back to medical school. Tell me a little bit about Carol that you
Carol, she is one of those special people you only meet once in your life. She was an excellent mentor, always very giving of her time. She was always present with you or whoever she was with, always devoted to giving back to all of her endeavors, whether it be at Alverno or the medical college or whatever committee or board she happened to be a part of at that time. I couldn't have had a better mentor than the people I've had in my life.
Was Carol friends with your mom?
Yeah, they both went to Alverno College together.
For nursing?
For nursing, correct, yeah.
Yeah.
And we're childhood friends. was a natural. I mean, our families knew each other, and so.
Yeah, I met Carol, many years ago, and she was the leader for her reunions, which I'm sure you will be for your reunions, and was on the alumni board. And when she first was diagnosed with cancer, she dropped off, but she beat it for a while. And but what an impressive woman.
Yeah, very strong.
Yeah. No, thanks for those comments, because she would have been somebody that would have been sitting in that chair being interviewed, and sad that we cannot. I already asked you about the graduate school faculty that you worked with and enjoyed working with. How about medical school? Any of the faculty that you had as instructors just really jump out as having been great to be taught by them?
There's so many more faculty in medical school. You just get this broad swath of all the instructors. I think, there's so many. I think people, like you say, that have sort of a personality about them, like Dr. Colasari, are the ones that sort of stick out in your mind. I always was fond of my time sitting back in the reading rooms in radiology too, and some of those faculty. Dr. Baines is another student favorite, I think, over in radiology. Very personable and engaging, and really brings people into the radiology experience. But in each specialty, I can think of people, and not even faculty. I mean, I think there's residents and fellows that are just outstanding. And a lot of the times you're working in those academic team environments, and it's that senior resident or that fellow that really takes you under their wing, that gives you really that intimate attention and education that really makes academic medicine come alive.
Well, it's neat that you're talking about that now, because many of the 30 or 40 interviews that I've done, people that graduated many, many years ago, they still talk about those mentors, those other residents that they worked with, the chief residents. It's a neat time. But we'll go back to medical school, and we're like repeating ourselves, because graduate school, president of the Graduate Student Association. Medical school, president of the Student Assembly, which I don't know this for a fact, but I'd be willing to bet my lunch money on it that you are the only alumnus that was president of both the Graduate Student Association and the Student Assembly. Similar reasons to get involved as a medical student?
Yeah, I think it was just another platform. You're sort of faced with the same circumstance. You want to get involved, you want to have a say and try and improve the environment for yourself and those around you, and give back and try and really see what makes an institution click, and how do those decisions get made. And I think it's only when you get involved that you can be a part of that. And I was also the transition year liaison in my internship. So
okay.
It's just, I seem to gravitate towards those leadership positions.
Well, I think that says a lot about you. And having worked with you in those leadership positions, I mean, it's certainly warranted. I do remember having we probably had a little fun when you kind of recycled back through as president of the Student Assembly. I mean, it's like deja vu all over again. But that's great, because you were here for what, 9 years. You know? And now you're still here, doing your residency.
And it was a very dynamic time of transition in medical school, because they were redoing the curriculum, and so being a part of that, it's a lot of change. I had a new dean at that time, and just lots to keep track of, and lots of opportunity.
Well, you mentioned one of the physicians in radiology who you first came in contact with as a medical student, and now you're doing your residency in radiology. My question is, when did that bug, was it planted that I want to be a radiologist?
I didn't really decide it until my 4th year in medical school. But if I had to think back to my first bug of radiology, it would have been in undergrad. I worked at a Marshfield Clinic urgent care, and I would go into the back reading room, and I would help one of the female technicians. She couldn't have been all taller than about 4'9", help pour the chemicals into the developer, and because they were still using film back then, and just be back in radiology and in that just medical environment of an urgent care. where I started to appreciate what medicine, how it worked a little bit, and how radiology fit into that. And so I always look back to that, but more presently, it's the exposure you get in medical school and how you like to learn, how you like to practice medicine, what parts you take away from it. In radiology, you get to work one-on-one with a staff radiologist, and there's that learning, and there's a lot of independent study on your own. It's a very cerebral field. So those are all things that factored into my decision to be a radiologist.
No, that's great. And so we were 2016, you graduated in 2013. How much more study do you have in your residency? Is it one more year?
So there's 1 year as an intern, 4 years as a resident,
Okay.
and at least 1 year as a fellow.
Okay.
Pretty much everybody in radiology does a fellowship. So I have 2 more years of radiology residency,
Okay.
and then another year of fellowship after that.
And at this point, fellowship sometimes relates to some sort of specialization. Do you have an interest that?
Yeah, I lean most towards it's the decision-making time right now to decide what kind of fellowship I want to do, and I lean towards doing neuroradiology. Very in tune with my graduate studies,
Wow, yeah.
doing neurophysiology.
That's great.
So.
No, that's great. That should be really exciting for you. Now, the other question is, I mean, you've spent a lot of time in an academic setting. Do you see yourself, once you finish your fellowship, being in an academic setting?
I could easily picture myself being in an academic setting. I like the cerebral engagement, the collaboration and teamwork, lots of teams coming in and out of the reading room, and lots of different specialties and subspecialties to interact with, high acuity reading. I could also see myself in a private setting. I mean, I did a lot of my rotations at private institutions, and there's a different but equivalent sense of patient care that goes on there, and collegiality with the other staff that's there. There's pros and cons to both. You can't have it all, but ultimately I suppose I'll have to make a decision and find a job somewhere. But medicine is a great field. I don't think you can go wrong wherever you wind up going.
Well, I think you're certainly someone who's been around Wisconsin your whole life. Is that your hope that once you finish your fellowship, stay in southeast Wisconsin or somewhere in Wisconsin?
Yeah, I'd like to stay in southeast Wisconsin.
That's great.
Stay around here. It's a great place to practice medicine. My family is here, and I'd give back to the region that gave me so much.
Right, and actually, perfect segue, because I was going to ask you. You've been very involved with. When you're a graduate student, you're very involved as a medical student. You're involved as a resident. Maybe more than most. And what is you told me a little bit, but any other reasons why you felt it's important to stay active and involved? And as I noted, I will predict that you'll, get called when the 2022 they get ready to do the your first 10-year reunion.
10-year reunion.
Or 2023.
Yeah.
But they'll call you in 2022 and say, "Hey, Josh,
get ready.
Would you serve on the committee?"
Yeah. No, I look forward to that. It's one of those points in time where you can pause and reflect. It's kind of like New Year's Eve every year.
Yeah.
Reunions are nice that way. It kind of lets you know where everybody's at, where you're at, because otherwise you don't take a breath and reflect enough.
Yeah. No, that's a good point. Life's awfully short. I think people that don't go to reunions, I think most of them are making a mistake. The other, I was going to, kind of playing off on that. You've, have your grad student friends. You mentioned a number of them, and some that went out of medical school. Have you, it's only been a little while, but have you stayed in contact with some of your grad school and medical school friends?
One of my buddies just texted me the other day. He's doing his anesthesiology residency here in town. We meet up every few months to grab dinner or a drink or something. And I have friends all over the United States now that I drove down to Indianapolis last summer to visit a friend, and friends in Chicago, friends in San Francisco. It's like you keep in touch, and it's nice in the digital age. I have a group text from the guys I did my internship with, where every holiday or Super Bowl or something, there'll be a group text that'll come around and you'll check your phone and you'll have 50 texts.
Yeah.
It's like all the guys having a conversation. So
Well, with your class of 2013, would you consider it a fairly close class?
I think you get to know those 200 people pretty well. You know everybody, at least by name or face. And then you have probably a smaller group of people that you spend a lot of time studying with, and all the blood, sweat, and tears that takes it from someone in medical school. That's what brings you so close, and that's what spouses or significant others or other friends can't understand. It's those people that were close to you that really understand.
Yeah, and it is interesting when I'm talking to someone who's been out 40, 50, 60 years, and the names come back real quick.
Yeah.
And also what's I miss a little bit is the 50-year reunion, gathering to go to the graduation that they're part of, and guys that maybe not have seen each other for 50 years, and some are really good at recognizing in committee meetings on the phone, literally recognizing voices.
Yeah.
And it's pretty neat. You've got obviously Grandpa Irv as a physician. I'm sure he's a proud guy that you are now a physician.
Yeah, he's very proud. He actually just mentioned to me the other week at his birthday that he'd like to have all the physicians in the family get together and take a picture. I've got my great Uncle John and my grandpa and my uncle and then myself. And he wants to get that picture, I think.
That would be great.
That would be
you need to do it. Don't wait.
No, I won't.
Don't wait.
I'll get you a copy.
Well, I've asked all the questions that I wanted to ask. Is there anything else that you'd like to talk about or mention?
I just really appreciate what the medical college has done for me. I think I came here in 2003 just a different person. And maybe sometimes you don't appreciate it over time, over a decade, really, that I spent here in different capacities, that it really changes you and it grows you as a person. And on one hand, you commit yourself to this very advanced, intense education, but you get so much back for it. You sacrifice your youth in a way, but you get this trade-off that, I don't know, it's uncomparable, it's invaluable. And it's the collective effort of everybody that's here, and hopefully I can give that back someday. I try and be that role model resident and help medical students and so forth, and it's only, you're holding the baton for a little while. You pass it on and you try and help out your patients and your fellow colleagues, and I just think I'm really appreciative for what I've gotten here.
Well, Josh, thanks so much, and thanks so much for joining me today.
Yeah, thank you.